First, we still do not have any reported confirmed Ebola virus disease case as of 1st of June. We have a total of suspected Ebola virus disease samples that have been tested, which is 22 as at this morning, and all of them have turned negative. Equally, there are those counties that have been mapped out as either very high risk, others are high risk. The very high risk counties include Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, Siaya, West Pokot, Turkana, Homa Bay, and Migori. The high risk equally are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Kilifi, Makueni, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa. We have our laboratories that are ready for testing. We have the National Public Health Laboratory. We have the KEMRI, Nairobi, KEMRI, Kisumu. We have a mobile lab in Busia. The country has also been mapped. We have mapped a surge capacity of 118 healthcare workers that are on standby. And we equally have a felt-tip team that has been trained in the country of 90 healthcare workers. We also have other healthcare workers that have really been trained lately, about 70 of them. So we have capacity in case of a surge that we may deploy the healthcare workers. We will continue training and also sensitizing the healthcare workers. As at now, we have been able to sensitize more than 1,000 healthcare workers on issues, detection and also case management of any suspected cases. It is good to note that we have assessed the ports of entry and the readiness at the ports of entry, and we will continue deploying the healthcare workers at the ports of entry so that we can build on the capacity that is there. As at today, in the last 24 hours, we have been able to screen 13,548, and cumulatively, we have been able to screen more than 66,000 travelers. At the ports of entry, we will deploy measures because as we have already been working with authorities from different other countries to ensure that we have exit surveillance. We also are going to demand to ensure that there's screening from the country of origin before getting into our country, and everybody must produce evidence that they have been screened from the 10 countries that we are already screening at our ports of entry. It is important to note that our risk communication, we are going to up it to ensure that the members of public and the communities know exactly what they need to do. As at now, we want to encourage members of public to ensure that there are high levels of hygiene. And should you feel unwell, do not run to the chemist to buy medication. Please ensure you run to the nearest health facility for further assessment.
Many outbreaks, especially here. Of course, in our region, Uganda, so I will skip this. Of course, he has also talked about that. And this is the map that shows the iris counties, the 25 of them that the director has mentioned. Mainly, most of those counties are on the western areas that borders Uganda. So most of the symptoms are non-specific, and that makes this virus now too dangerous, because you would think it is some other disease. When they present with fever, vomiting, abdominal pain, these are non-specific symptoms. So the last phase is when they now present symptoms of fever, of acute onset, vomiting, diarrhea, abdominal pain, headache, body ache, lethargy, and bleeding from body pain. Again, to increase sensitivity of SARS after taking samples. That is a confirmed. A health care worker, a commercial sex worker, hunter, an animal handler, forest ranger, or a parent. Then we have the second category, purposes of assisting our community and promoters to also pick cases early enough in the community. And it's a late case elimination. Any person who presents with requires having had either body hotness, body weakness, headache, sore throat, diarrhea, or a misbehavior. And then finally, we have community events-based surveillance, and we utilize our community health promoters. We've trained them in this, is the signal that they need to report to them, assess, and then send a sample if that requires sending a sample. Increase awareness in the community is very key, because these are people who are working within the community and they know everything. Contact identification, tracing, and follow and effective implementing the surveillance. Then go to what we are doing as a country. And those are preparedness measures. We have not gotten any case. Most experts about the Ebola that we have responded to. None of them has done a positive result from the test. So what we did immediately, this was notified, is the National and County Public and Emergency Operation Centers were activated to alert more. It is still in that alert mode. We have one national public and emergency operation center, and response plan has been developed and posted. EVD preparedness response advisories have been disseminated to the counties. And alongside this, there was also body weakness, headache, sore throat, diarrhea, and explained bleeding. Alternatively, any person who develops either body weakness, headache, sore throat, diarrhea, and explained bleeding have to send contact with a person to the right of food. So again, if you look at this, these are not specific, but it's part of our early warning system using community. The viral hemorrhagic fevers. And then we continue sensitizing healthcare workers on EVD. We've done quite a lot. And then enhance risk communication and community engagement to raise awareness. We also need to consider deployment of such team to the most high-risk counties to support the preparedness measures. And should any case be imported to Kenya, they should be able to be deployed immediately. Madam PS, I think that is what I wanted to share with the team here. I will pause there for
from Uganda, the cross-border collaboration. As Dr. Longat has alluded earlier, we have enhanced screening in our partner that receives truck drivers from here to Congo, Uganda. So it was a high-risk border because we divert all the drivers to use Waka. And this is an area that we really want from Uganda yesterday. We had a process. And the situation in Uganda is not very good. So we need really to tighten our Congo and Uganda at the same time. JKIA is one of the critical areas again to know. We have enhanced training in all the leagues. And I've activated the robot that we were using during COVID-19 pandemic, and it is working. It can pick now temperature, look for ice specialist of the robot to come and fix it, and it's now working at JKIA. So when you go to, yeah, we didn't have the extra, so a lot of stuff. Thank you.
Yeah, so thank you very much, Benjamin.
But now, as time has gone by, we have deployed one lab, that is mobile lab to Lucia. The testing, yes, we have like, when we constitute in the lab, we have about 3 labs. What we need to have is more reagents and SOPs, and also activating some of the equipment, which would be
Maybe lastly, PS, because we've covered most of the agenda, I just wanted to go back to Dr. Langat, and I know this is a question to Larais. In terms of our response, suppose we get to confirm a case.
Early as even by noon, we have a lot of avenues that we can tap into. We have Safaricom, we have the news media. Why can't we just have an FAQ corner within the mainstream media that can be able to respond quickly as we wait even for those other things that is actually verified? That said,